Hi, my name is Michaela Fortlander, and this is my audience. Alright, so according to a scholarly journal that I found through Ball State's database, 84% of prescriptions filled in the U.S. today are generic drugs. So based on that, I'll be sharing some benefits that generic drugs can offer you, such as cost, availability, and the physician's knowledge on it. I chose this topic because it affects everyone, because it's important because of the rising cost of healthcare. So the first graph or visual that I want to show you is patients' perceptions on drugs, and it says whether a doctor should prescribe a generic drug for you if one is available. And this survey is 134 people responded out of 189 contacted. So these are the results. Only 45 people, or percent I mean, said that their doctor should always prescribe, and the safety of the prescription drugs on the market for a long time versus drugs newly on the market, 53% only said it was safer versus 1% said it was less safe, and 46% said neither more nor less safe. Whether newer drugs are better than older ones, 18% always or usually, and then 80%, which was the popular vote, said that the new drugs are better than the older ones, or sometimes. And Americans' use of generic drugs, only 68% use generic drugs. This is the next visual that I will get to. So based on costs that I mentioned earlier, the American College of Physicians urge doctors to prescribe generic when possible, which saves Americans trillions of dollars in the last decade, which I think is phenomenal. The market has remained stable since the Hatch-Waxman Act was put in place, which means that the increase in competition means that the decrease of price in the generic drugs. And in the year of 2015, out of the 4.4 million drugs that were prescribed or dispensed, 3.9 million were generic drugs. And this saved Americans $227 billion in 2015. Excuse me. So availability, the brand name, they use strategies to try to keep generic drugs down, which is such as pay for delay, patent settlements, authorized generics, which they call AGs, and product hopping. But generics are easier to obtain than brand names, because especially over the counter, like ibuprofen, Aleve, Advil, that kind of thing. But generics may not always be available when they are prescription drugs, especially when it comes to cancer. But the overall goal is to make everything generic everything, so it saves Americans money. Moving on to the physician knowledge, 88% felt that the cost of medicine was important when it came to consideration of writing their scripts for their patients, but only 13% were educated on those costs, and 8% said that they could care less about the costs that causes their patients grief sometimes. Most physicians seem predisposed to cost-effective medical practice, and when asked physicians to estimate the cost of your generic drugs, like I mentioned, the ibuprofen and stuff like that, they usually overestimated, as you can tell here. Like the cost of 30 days supply, the overestimation or underestimation, and then correct responses. But 4 out of 5 physicians are actually unaware of the costs, like I mentioned earlier, and most overestimate. The downside of the physician's knowledge of this is medical schools and residency programs don't formally educate these people on the cost in generic names. So if you go to the doctor and you ask them to prescribe you a generic version to save you money, they might not know the name. So they try to, not really try, but they don't know the name, so they can't give you the generic. But they also don't know what generic brands are covered under insurance with the pharmaceutical companies. So, and then to conclude with today, generic versus name brand drugs, the FDA requires that generic has all of the same ingredients that brand names have, and so they're basically the same. Generic just offers lower prices, lower prices, and it's, if I were to blindfold you guys at two different separate times of the day to give you like Advil versus ibuprofen, you wouldn't know the difference. So with that, thank you. And this is my audience again.